We moved here 4 years ago, and I had to have my blood pressure medicine refilled. So I picked a doctor, and I went in, and he refilled my meds. He said, "Is there anything else?" And I said, "I'm real tired." And he brought me back into the office, and he gave me this questionnaire, and he said, "Fill this questionnaire out." Well, 18 positives out of 20. And he said, "You're having a major depressive episode." And I just busted out crying because, I have a stigma now. I'm that age where, you don't pray enough. You don't have enough faith. Well, you must have done something wrong. And all of that hit me in my head at the same time. And I was like, what have I done wrong? What have I thought I prayed enough. And medication and somebody to talk to later. And I realized that's, well, I've had depression since I was 8. Thought it was normal.
I would argue that I experienced it really young. It was hard for me to get out of bed. I skipped a lot of class. My grades started failing. It got really bad when I was in college. And that's typically what we see, based on my own knowledge, what I know now, that's generally when it starts to get really bad. I could not find the motivation to do anything. I was tired all the time. And it wasn't just that I was sad. It was that I felt like there was nothing available to me, that nothing would ever change. I just became completely hopeless. And one day I just was fed up and I said, I cannot do this anymore. So I went into my counselor's office and I told her everything. And she said, "Have you ever thought about medication?" And I was like, "No, why would I do that?" She said, "There's nothing wrong with it. People who are diabetic, they need insulin. People with depression, their brain's not producing enough of the hormones that make us feel good. And that's all the medication does."
We've made a lot of progress as far as medications go. And again, this tracks with our understanding of mental illness. And so we have medications that are able to target some of the ways we know that the brain changes with depression. Some of the neurotransmitters or the chemicals that are involved, the classic ones that we think about are serotonin and norepinephrine, but there are a lot more that are involved.
Serotonin, norepinephrine, and dopamine are neurotransmitters. The human nervous system has more than 40 of these chemical messengers. Serotonin contributes to feelings of happiness. Norepinephrine plays a role in your body's fight or flight response. And dopamine is a factor in pleasure, motivation, and learning.
Dopamine, histamine, acetylcholine, all of these have roles in how we function day to day, and especially in terms of our mental wellness or illness.
And I started taking medication, and honestly, my life turned around. I had no idea that I could feel that good. And so that's kind of when my career path changed. I had wanted to be a marriage and family therapist. And actually that same summer, somebody in my family had attempted suicide. And that's kind of when things changed for me. And I think that's why I'm so drawn to crisis work and trying to help pull people out from the places that they've let themselves get to, or that they've just unpacked there. Because I was there once and I saw no hope. And all it took was somebody stepping in and saying, "Did you know this is available to you? Did you know that you don't have to live like this?"
Medications don't work for everyone, though. And unfortunately, we don't have a great remission response or people who get all the way better with medications. That's at about 30%. But that means that 30% of people do get all the way better with medications, which is great. So I think when I talk to patients specifically about depression, I say medications can work. Therapy can work. What the evidence shows us is that they work better together.
If you notice somebody in your family or your friends is acting a little off, talk to them, talk to their parents, talk to them, and find a doctor. Find a doctor that will listen to you and communicate with you. And if your doctor is not listening to you and communicating with you, get another one. Find one. Go until you can find one. Because my doctor she has changed my life. Honestly, she's changed my life. I'm a different person. I'm a person. I'm not a lump. I can laugh and mean it. I can, somebody tells a joke, somebody's happy. I can be happy with them. I don't have to fake those emotions.